When it comes to substance use prevention, many schools are stuck using outdated, ineffective strategies. Hi there, I'm Stan Baker along with co-hosts Shelley Steele and Steve Young. We're retired educators who worked in Ontario in neighboring school districts using restorative practices, and now we're coaching principals in restorative practices. Our guests this episode are Dr. Emily Jenkins, Associate Professor and Canada Research Chair, University of British Columbia, Scientific Director for Wellstream, and the Canadian Centre of Innovation and Child and Mental Health and Substance Use in Vancouver, British Columbia. And Dr. Ngieng, Deputy Superintendent of Abbey Schools in Abbotsford, British Columbia. They were both involved in a recently released research report called Transforming Substance Use Harm Prevention in Canadian Schools, an examination of school administrators' experiences and perspectives. The research reveals what actually works and what doesn't.
This episode is brought to you by Substance Use Prevention. Early childhood interventions before age 10 are more effective than teen prevention programs. Studies show that social-emotional learning, SE in elementary school, teaching skills like emotional regulation, decision-making, and self-awareness, reduces substance use risk later in life. Kids who feel connected and supported early on are less likely to seek coping mechanisms in substances later. Engaging in extracurricular activities, sports, and mentorship programs does reduce youth substance use, as well as creating a sense of belonging for teens.
Your feedback helps shape future discussions on restorative leadership of principals. Can you just take 5 minutes to click on the link in the podcast description and tell us what you think? Our website is www.restorative.ca, and it's for principals who deal with conflict, who want to make it right in schools, and who want to make it about kids learning. If all of this is making you feel a little bit overwhelmed, send me an email and we can talk. Stan@restorative.ca. Now let's join your host, Shelley, Steve, and me, Stan. We can start. Where did the idea or the impetus for this research come from in the first place?
For a number of years, I've been leading a program of research called TRACE, which is the Teens Report on Adolescent Cannabis Experiences Studies. We're 5 deep in terms of those iterations that have been ongoing since around 2009. And those really help to bring youth voice to the forefront of the academic literature on substance use, particularly that related to cannabis. And that opened new doors around what young people need, the ways that they are supported or feel support, how that ties into schools, and then our relationship with schools and hearing from teachers that they feel overworked. They feel like there's a big burden on them to address these issues that are not necessarily their own, and they're asking for support.
As Emily introduced me to some of the work that was happening out of Wellstream, in particular with this project, it just resonated with some of the stories that I encountered as an educator, both as a teacher and as a principal in a school, with the connections I've had with kids over the years, some of which were really hard stories, right? And the growth that happened for me as a human being, and the understanding of why an individual might engage in substance use, and the need to begin to look towards upstream approaches. I can point to many instances in my career. I can think back to one as a principal in a school, elementary school, and seeing the first time a young boy, 12 years old, addicted to crystal meth, which was shocking at the time. But I think the story underneath that was the want for connection and belonging. A young person who, through no fault of their own, the circumstances, and then the access to substances and their way of coping, what they were really seeking was connection with caring adults, right? Would walk across town to come see me, would walk an hour, right? And it was just that opportunity to spend a little bit of time in the office with me. And that's what he would come to school. And I think I built on that experience and understanding. And it just made me realize the lack of resources or understanding within a school context. The adults within the education environment want to do well, but need some guidance and support. And so as we looked at through this particular project, opinions of principals and vice principals that truly resonated. People want to try and are willing to try. They need some guidance. And I think this partnership is uniquely positioned with health and education to walk hand in hand to understand what's happening in our schools so that what the net result of this work and this research will help inform best ways or evidence-based approaches that schools are willing to take on, but just don't have access currently to.
And so in this research, because I really like how you've set the stage there in terms of, and Emily, you referred to it as well, like the role of the school in all of this. And Nathan, you talked about the caring adult and the importance of a caring adult for youth. Were there any surprises for you in this research?
I don't know that there were any surprises per se. It was confirmation of what we have been hearing for many years in our work as it's interfaced with schools. And I think it provides a very comprehensive capture of that in a way that was systematic and rigorous, and that we can now draw on as we're moving forward in this work. I think where I was heartened was in some of the data around principals and vice principals' willingness, their desire to learn and understand and have evidence-backed resources and guidance to do this part of their work that they're doing every day, but in a context without those needed materials.
I was a principal for over 20 years. I can relate to some of the answers I think that some of them gave, some of those principals and vice principals gave. And the piece around time and the time that they have, if we think of time as a resource and it's a diminishing resource, that they estimated the amount of time they spend every week dealing with substance. And then the fact that it's increasing, that they perceive that it's also now increasing to a point where they're going to get to a point where they just don't have the time to do everything necessary to really do an effective job in managing substance abuse and all those pieces around it. So what do we do with all this data, and especially around that whole concept of resources and time that the principals are saying they just don't have?
What we heard was that 1 in 5 principals are spending 6 or more hours every week dealing with substance use among students. That's significant. It's a good amount of time that obviously has an impact on the amount of time that they have to spend on their other leadership roles. And so really what we're trying to do in our work is to alleviate some of that system burden and to provide evidence-backed, clear, accessible, ready-to-use resources to work in partnership with education to shift policies that to make sure that they are supportive of practice every day in school settings, and also that those are updated and aligned with current evidence. So our team is working to develop national standards for substance use education and intervention in K-12 schools. Importantly, this work is being done in partnership with education professionals across the country. We really want to move beyond some of the historical barriers where health has come up with something in their own little silo, and then they've shown up on education's door and said, we're here, take this on, add this to your already full plate, and it may or may not work with the everyday realities that you're navigating in your systems. So we want to try and address that issue at the outset by doing this hand in hand with our education partners and make sure that the end product reflects the needs of the education sector. So those are really intended to provide that guidance so that we remove some of that professional burden, so we protect professional safety, and so that we free up time within the system for all of the other wonderful things that principals and vice principals and other education professionals are doing to support young people's healthy development.
And I would add, Stephen, you talked about the diminishing return of the time spent. So we were heartened to hear that administrators are willing to try some different things. And what Emily spoke to is the partnership. So in collaboration with, rather than being told to do something. And I think that's what makes this so unique, is we're not coming out and saying you should do this. It's what's the voice in the field about the impact. And so what we're hearing, which reflects on my experience as a principal, yours, is that you're going to spend time on this issue because access to substances is out there. And so what has historically been our approach and what hasn't worked, because that's the other thing that this survey pointed to, is that the lack of resources out there drives schools into ineffective practice potentially. And so having some national standards set with some careful consideration of the voice of the field will help us create something that will provide some guidance that will be accepted, and that there's a willingness amongst staff in schools to try something a little bit different. This idea of connection with young people. I've heard that time and time again around when we start to talk about substance use, and I heard it again the other day. The underlying question is, have you asked me how I'm doing, right? That's something that resonates in my head when we've asked young people about getting involved with substance use and the impact, and they reflect back is you tell me not to do something, but you've never asked how I'm doing, right? And I think that's so critically important, and that upstream piece that Emily talked to earlier will help inform better approaches, and schools are willing to take different approaches. They just need some guidance and support with that.
What I wanted to find out about a little bit more in terms of the building connections, and both of you, Emily and Nathan, have referenced ineffective strategies. What kinds of things would you say to principals and vice principals? Look, this doesn't work. Our research shows this doesn't work.
There's a lot that's going on out there that doesn't work. So our team recently completed a systematic review and meta-analysis, which means that we looked at all the published literature that's out there on different interventions, programs for preventing substance use harms in schools. And what we found is that by and large, these programs don't work. They don't change how substance use behaviors among youth. They don't necessarily improve educators' confidence or ability to do this work. And part of that, I believe, is that they are these standalone programs. They're one-off, they're curricular in nature. You check the box to say, we did this 6 week intervention. We taught people how to refuse and just say no, and it didn't work. But it's not connected to a broader strategy around how we support young people in schools, how we create connections, and how we do this work and see it in every component of or aspect of the system. So I was talking recently to Nathan about how many programs that are effective for substance use probably have nothing to do with substance use at all. And I'm seeing nods. So that resonates with people on this call, but that's still, it's what you look for, I think, when you're in practice, because without that guidance, that's something that you can hold on to and at least feel like you're doing something, right? And it's also heavily marketed to the sector, and it sounds appealing. You've got this program, you do it, and then hopefully things change. And then they don't. But so the work that we're trying to do right now is to say, let's use a comprehensive school health framework. Let's make sure that the way that we're approaching this attends to policy and practice, that it attends to teaching and learning, that there are trajectories or pathways through the school and externally to supports beyond that setting for those who need it. So we really want to create a culture change. We want to help people to understand and do this work differently, and so that it's not entirely falling on the shoulders of teachers or the shoulders of administrators. We see this role as relevant to everybody in that school building, whether it be the person who's answering phone calls or supporting the administrator, whether it's the janitorial staff, the coach that has them for basketball or rugby. All of these people play a role, and so much of it boils down to that opportunity to create a trusted connection with a young person so that they feel like they know where to turn if they need support.
I was just going to add the other piece that I think is important that needs to be addressed within the system, and it came out in the survey as well, is still the reliance by a high percentage of the respondents on zero tolerance policies. And we know that doesn't work. And to Shelley's point, what happens when we move to those policies or procedures, we're actually doing more harm to the students. It creates isolation, this idea that they're bad, and could further drive them into substance use because we haven't addressed the underlying issue, which gets us back to the connection to adults and this idea of a nurturing environment. And we would hope that through this work, that school districts can have a body of research to pull from that would really remove the need to have zero tolerance policies in place, knowing that they are ineffective and harmful in terms of addressing those particular behaviors in students.
I was just going to add that what we heard from principals and vice principals was that those zero tolerance policies, often informed by a board or at the ministry level, created a lot of distress for them because they felt that they weren't in the best interest of students. And so they are risking acting outside of the scope of the policy that's meant to guide them. So there's this need, and the comprehensive school health approach directs us to look at those policies that shape education practice or directed in particular ways.
When you talked about those programs that people try that aren't effective, we used to call them programs in a box. And the next somebody come along, hey, we got this great program. If you do it for 6 or 8 weeks, it'll cure all your problems. And it's only $395 and it comes with CDs and it's a great thing. And you pass it all out and everybody does it for 8 weeks. And that's going to cure bullying. It's going to fix whatever the problems. And we know it doesn't, but it looks good for the people on the outside looking in because they say, oh, you're doing something. What are you doing about this? We did this program and this program, oh, you're doing something. That's good. So it was more of a public relations thing on the part of the board to say, all our schools are doing this program. The program that I always felt worked the best was restorative work and building those relationships, that what you call the upstream work, doing the proactive work. And I noticed in one of the charts, the number of principals who report that, when they're dealing with students or even parents, building relationships and having that connection with them is so important. But I was quite surprised at the number who didn't say that was the first thing they did. 85% looks good on just about anything, but what about the other 15% who don't think it's a high priority? And to me, that should be 100% answer. And when you talked about the zero tolerance piece immediately, and Stan and Shelley know that's school discipline policies using a restorative approach has been the work I've done for 20 years or more. And that whole concept of zero tolerance and punishing people changes their behavior, which is the basis of restorative. We know punishment doesn't change behavior or even the threat of punishment. And yet we do it because the policy says we have to do it. And I know early on in my career, I suspended a kid. I don't know how many kids I suspended for having cigarettes. You're not supposed to have them on school. They weren't smoking, mind you. They just had them on their person or their pocket. Now, the one time I did suspend a kid, he got in more trouble from his mother because he'd stolen her cigarettes. And she was mad at him for stealing her cigarettes, but that's another story. The zero tolerance thing we know doesn't work. And yet there's an expectation that there are consequences. If a child is smoking on school property, if they're vaping on school property, if they have drugs on school property, you must call the police. It's not I don't feel like it is, you must call the police if there's drugs on school property. And then that whole piece comes into play, and it's not therapeutic and it's not going to lead to that change. So I guess what I'm saying is I'm hoping through this work that you're doing and keep plugging away at it, that the smart minds out there start to think we can't discipline our way out of this problem, that we have to start changing the patterns of people's behavior from a very early age. And so that's the hard work. We all know that's the hardest work. It takes the most time. And I'm not sure where we're going to find all that time. We've talked about this in all our things. Where are we going to find the time to do it? But it's such necessary work and we can't just ignore it. So as a former principal, it was always great when I knew that there was something I could draw on, that I know this is proven. I know that person can come in and help me because I don't have the time to do it myself, but I know that they can do it. I also was heartened by the fact that a certain number of principals indicated on that chart that they don't kind of look to the policies to guide them on some of these things. And I read that somewhere in the report that sometimes they don't ignore the policy, but they use it more as a guideline than a hard rule because they know the context of the child they're working with, this isn't going to help them. And maybe that's the way to go. They have to sometimes buck the trend and buck the system to do what's best for each child in their own situation.
I think one of the things I would reflect off of your comments, Steve, is we have very caring administrators in our education system. And so they recognize when a policy potentially is harmful to the student. And I do know of stories where they've moved in a different direction because they know the outcome for that student is not the one that they want. And I think that points to, again, in the study, the high percentage of administrators that would try something different. And the hope would be that, again, that every district would look at these policies that they have in place that maybe aren't based on evidence, and that the work being done through Wellstream and through Emily and her team is that providing a structure or a framework. So talking about comprehensive school health, I think the unique position education is in to partner, right? As a school district, you're not in this alone, right? And so that's one of the questions that's come up is why does school have to deal with this? They're going to deal with it anyway. We know the time that they're spending, but it's about true partnership. I know from my context, we work with Impact Society, who directly supports and has avenues of support, and the importance of our counselors, knowing to have connections with those counselors. We work with the YMCA and alternate to suspension in in-house ways. We work with restorative justice and the use of circles on I'll say for all schools, right? And have that available. And so this multifaceted approach and partnership, it just needs some guidance around some research, and the national standards would go a long way to bringing everyone together to row the boat in the same direction.
Maybe it's a good time to add that following the development of national standards, the plan is to continue this work in partnership with education to support the development or co-development of resources for practice. So really to transform the standards into materials that can be used in everyday practices in schools by educators, and so that they have what they need to do this component of their work. And this may be a considerable amount of their time right now that they're spending. I do think that ultimately when we are working together and we're supporting the systems in these ways and working differently, that it will lead to a reduction in the amount of time that's spent on these issues.
I think it's very much like you say, Emily, in terms of time, it's a pay me now or pay me later. Like you're going to have to spend the time one way or the other. It's going to be 6 hours of enforcement or 6 hours of prevention. I wanted to know a little bit about what were the most effective strategies that you found in terms of giving advice to, say, new principals and vice principals.
I think that's part of the work, the gathering of information, Stan. What I would say is there's reference to a multi-tiered system of support. And I think that's not an unfamiliar framework in education. We talk about, it's gone by other names, it's gone by response to intervention, it's gone through positive behavior support in schools, but it's this idea that the continuum of support and primary prevention to intervention at a secondary level for those at risk, and then those who would be involved in a tertiary level. And it's this idea that I'll go back to the connection piece. If we create nurturing environments, my advice to the principals and vice principals, and I fully have believed this throughout all my years as an educator, if we create environments where kids feel heard and seen, and that goes back to, I know I've talked about this idea of, do you know your kids' names? Do you ask them how they're doing? Do you ask them the right questions from a teacher lens? And as a principal, I always met in the morning, stood outside and said, good morning, Johnny. Good morning, Tracy. How are you? Like that is as a simple starting point from a primary prevention lens, because it's about connection with kids. And that can start right in elementary school, right from the time they come into kindergarten, right? I used to walk into all the classes. That is really a fundamental piece. So to your point earlier, Steve, around 15% still didn't identify that connection piece. That's really a great starting point for us. It's the center of restorative practice. It's the center of what we know from recent research around the importance of caring adults within a school environment. And so we can control that, and we can do that for all kids. Then to the very structures in school, when we know that there are certain kids who might be more at risk due to some of their life circumstances or what have you that are out of their control, we can be more focused in. And I think this is the piece too, when we start to talk about what will come with the research and some of the national standards of being a little bit more evidence informed about some of the best approaches to use when we know that there's a higher likelihood that a particular group or an individual might be more involved. But it really starts from our importance from a school level, as whether you're a teacher or a principal or a vice principal, and making sure that kids feel connected through whether it's consistent expectations, right? And the ability to support and encourage students to have those connections, whether you're a principal, and setting the stage for teachers to be able to engage in that work. And you do that through what you put as priorities in your school plan. And then I think the other piece is the incredibly important role our partners play. So this is not education's alone, right? And so I pointed to the partnership with local restorative justice associations, or whether it's a program like alternate to suspension or take a hike or things like that, schools need to look in untraditional or unconventional ways to support connection with young people in schools.
Traditional approaches like just say no, zero tolerance, and punishment just don't work when it comes to substance use prevention in schools. Connections with trusted, caring adults does work. Adults form strong relationships with kids, and this is something every person, and I mean every person in school, can do to prevent substance use. This is where it starts. And we're not stopping at this conversation. We want your perspective. What resonated with you? What challenges do you face? Take 5 minutes to share your thoughts, and I'll link in the podcast description. Building relationships with students and trusted, caring adults is part of what schools do, and do well. Now, if this is still overwhelming for you, we can help using restorative approaches. So email me, stan@restorative.ca.